Hi, dear students, and welcome back to my YouTube channel. I am Dr. Dvipika Garg, MDS in Orthodontics and Endofacial Orthopedics. This YouTube channel has been opened with a specific indication in mind, that is to help all the aspirants who have completed their BDS and wish to do MDS. Okay, so yes, there are a lot of guidances available, but this is my way of guiding my students. So yes, this is an open YouTube channel for all of you out there who are ready to sit for your NEET MVS examinations. So yes, and all the previous video lectures, I hope you all have gone through them, and a lot of test series are waiting for you people. But yes, all the test series will not be directly put up. There would be a bunch of lectures followed by a test series. Bunch of lectures and test series, okay? Because yes, most of the questions in the test series will be coming up from the lectures you have already attended, meaning the ones which have been uploaded, and few test series will have questions on lectures which are not yet uploaded but they would be. So it is basically to make sure that whatever you people have read in the lectures, you are clear with it, because those questions you'll be getting correct, and the ones which are new, so yes, you know, you need to work up in that particular area. Okay, so let me revise few things again for you people. 240 set of MCQs will be there in your question paper. If you get one answer correct, 4 marks will be awarded to you. For each incorrect response, yes, we do have negative marking and 1 mark would be deducted. So if you are not sure of the answer, so you have to contemplate whether you want to fluke it or you have to leave in unattempted, because 0 marks would be given then. So yes, you know your target, and if you don't, it is very important to set up the target first. So yes, you should know your target, you should know your goal, you should know the amount of time in you have in your hand and number of subjects to be covered. Once you are done with this, you should know from where you are going to cover each and every particular subject. For example, when it comes to ortho, you know that you have my YouTube channel. Suppose if you have perio, endo, you should know from where it has to be covered, which books have to be referred, and how many MCQs to be done daily. So yes, setting up your target comes in one of the initial few things which have to be done. And of course, let me just revise it again, importance of image-based and patient-based questions. So with this, let me start with our very first test series, the very first question of this test series. So the first question is, calcification of which bone is important for pubertal growth spurt? Now this is a question which has been taken from skeletal maturity indicators. Skeletal maturity indicator is a very important topic. Now skeletal maturity indicators are your hand wrist radiograph. Okay, one of them is your hand wrist radiograph. Of course, we have a lot of other things. But in hand wrist radiograph, when you talk about sesamoid bone, so when you check the presence of sesamoid bone, in which stage it is, you get to know about the pubertal growth spurt. Okay, now similarly, calcification of sesamoid is one of the important features of pubertal growth spurt, which is early in females than in males. Okay, puberty hits early in females. Whereas hamate and pisiform, they tell us about the prepubertal growth spurt. Okay, so it can be prepubertal or pubertal. So when you want to judge anything about prepubertal, you will check for hamate and pisiform. In case you want to check about pubertal, then you will go in for sesamoid. Okay, so this is the hand wrist radiograph. Studying hand wrist radiograph is a different topic altogether. But yes, a little bit of basic things which you should be knowing is the importance and calcification of sesamoid, pisiform, and hamate. Okay. Next question. The articular angle is large if mandible is. So, before I get to articular angle directly, let me tell you a little bit more. See, there is something which is known as Bjork sum. Bjork sum is equal to 396 degrees. Bjork sum is formed when three angles are calculated. One is your saddle angle, next is your articular angle, the next is your gonial angle. Combination of stellar, articular and gonial angle, okay, gives me my Bjork sum. Articular angle is calculated when point S, AR and GO, that is gonion, they are all made to join. Okay, so saddle angle is formed in a different manner. Articular angle is formed by use of three landmarks. That is your sella, articular, and gonial. This forms my articular angle. So if my articular angle is large, if this angle is large, it means the mandible is retrognathic. My mandible has rotated clockwise and it is a case of class 2 malocclusion. So yes, if articular angle is large, it means when I'm joining sella, articular and gonial, this angle is large. It means my mandible is retrognathic. Okay. Moving on to the next question which we have is uprighting spring is used to now. I'm sure uprighting spring is something, I'm sorry, which you all might not have done earlier in your BDS days. But yes, you should be knowing about it. See, uprighting spring. What do you see here? Your molar is mesially tilted. Okay, so now the roots are distal and my crown is mesially tilted. Now, if you want to upright this particular teeth, what do you have to do is move the root portion mesially. So my crown and root are inclined this way. My molar is sitting this way. I want to upright it. So to upright it, I give this uprighting spring. Can you appreciate this particular thing? This is your uprighting spring. So when you use the uprighting spring and upright a tooth, you basically move the root in mesiodistal direction. The root is distal and you want to move it mesially. So yes, when my root moves mesiodistally, it brings about uprighting of the tooth, which is done with the help of uprighting spring. Okay, so the correct option is option B. Move the root in parietal direction, labiobuccal, you do not use an uprighting spring. Closure of space, no. Derotated tooth, no. The correct option is to move the root in mesiodistal direction. Moving on to the next question. If value of Biot sum is more than 400, what does it indicate? So yes, we have just done this by chance. So Biot sum is the angle, which is the sum which is formed by three angles. First is your saddle angle, next is your articular angle, and the third is your gonial angle. Okay, and the most common the average is 396 degrees. Of course, there is a standard deviation. Okay, so if my Biot sum is more than 400, it means that the patient has a vertical growth pattern. The patient is hyperdivergent. Hyper. Okay, and if the value is below 396, okay, if they say if the value of Bjork sum is less than 396, it means my patient is hypodivergent. That is, he is a horizontal grower. He has a horizontal growth pattern. Why and how? See, if my saddle angle is more, articular angle is more, and gonial angle is also more. So what is happening is basically my lower anterior facial height is increasing. Okay, along with that, my mandibular angle is rotating clockwise, leading to a retrognathic appearance. Okay, so when all these things are increasing, my growth pattern goes vertical and the patient becomes hyperdivergent. Growth pattern can either be horizontal or vertical. Horizontal is also known as hypodivergence and vertical growth pattern is known as hyperdivergent. So Biot sum, remember, if it increases, the patient is hyperdivergent, and if it reduces, the patient is hypodivergent. Okay, moving on to the next question. M spring is used for. So yes, students, I know these set of questions are a little tough and they are new for you people. But yes, there are few things which you have to, like really remember. You don't have a concept for each and everything. You have to just remember a few things, and one of them is this particular question. Okay, so yes, this is an M spring. Can you see it is in the form of M? And what do you see? There are loops in between. Okay, why these loops are given? When loops are incorporated into the wire, it increases the length of the wire. With increase in length of the wire, my flexibility also increases. When there is increase in flexibility, there is increase in range of action of the wire. So if earlier without the loop, if my wire would work up to suppose 5 millimeters, with increase in length, there will be increase in the range of movement and it can work for a longer place, for a longer diameter, as in for a longer period of action. Okay, so the range increases. amount of distance increases basically. So my M spring is used for closure of midline diastema. This is a case of midline diastema. So to close this, we give this M spring. Okay, so yes, for treatment of open bite, we use box elastics. If this is a case of open bite, can you see this elastics running from here? This it is in the shape of a box. So box elastics are given for correction of open bite. This results in extrusion of my upper and lower teeth, thereby correcting my open bite. So this option is cancelled. This option is cancelled because my open bite is corrected with the help of what? Box elastics. Next, for treatment of posterior crossbite. See, this is how a posterior crossbite looks, this particular figure. Okay, so to correct the posterior crossbite, we run an elastic from the buccal surface of upper to the lingual surface of lower. So this helps in correcting my what? Crossbite. So yes, for the treatment of posterior crossbite, we have cross elastics. And for occlusal settling, we have W-shaped elastics and M-shaped pattern elastics are given. So M-spring students is used for the correction of midline diastema. In M-spring, we see the presence of these loops. These loops are given to increase the length of the wire, which will eventually increase the range of action. Okay. Moving on to the next question which we have is, Cetlin appliance is used for. Again, this is important and maybe this is a new thing for you. You have not read about Cetlin appliance earlier. So Cetlin appliance is an appliance which is used for distalization of molar. This is the Cetlin appliance as shown in the figure. Here you will see that we have Adam's clasp. Adam's clasp is used for retention. Anteriorly, you have a labial bow. Labial bow is used to bring about certain corrections. Maybe if my anterior teeth are proclined, if I want to retract them. Okay, so this is used for retention. You have your anterior labial bow, short labial bow. And over here, when you see, you have this loop and a wire is running this way. This particular wire component helps in distalization of my molar. Again, same concept. Why is this particular loop added over here? Because it will increase the length of my wire, which will increase the flexibility, which will eventually increase the range of action. So yes, and anterior portion is to bring about stabilization and to retain the appliance intraorally. And this is used to bring about molar distalization. Most common appliance which we know which brings about distalization of molar is a pendulum appliance. Okay, but this is a Cetlin appliance. In case you have not heard of it, yes, this is used for molar distalization. Moving on to the next question. Coffin spring is used for. I'm sure you have done this question multiple times. We have discussed it in lectures as well as previous MCQ question. Coffin spring, this is a coffin spring. It is used to bring about expansion of the dental arches. These are my Adam's clasp to retain the appliance intraorally. Okay. Next question. Development of palate occurs at. Now, this is something which needs no explanation because, yes, few things have to be mugged up. One of them is this. My palate develops at ninth week of intrauterine life. Okay. So, remember, development of palate is at ninth week of intrauterine life. So yes, I hope students you have a pen and paper in your hand and you're attempting the questions along with me. Till now, what I feel is this question you all might not have got it correct. This also is a difficult one. This is again a difficult one. 3. This is also difficult. 4. This is also difficult and new. 5. Okay, 6. Even this is difficult. Okay, maybe this is very easy, so you all should know it. So yes, I know this is a very important, set of questions, and plus they are difficult for you people. Don't get disappointed if you do not score well because you have learnt a lot of new things in this. And now you know what a Cetlin appliance is. It is for molar distalization. Okay, now you know what is M spring. It is used for closure of midline diastema. These things were new for you and you have not read it earlier, so that is completely okay. But now you know it. That is important. Okay, so do not get disappointed. Next question. Yes, moment to force ratio for bodily movement is. Now, let me explain this thing to you now. See, there are different kind of tooth movement which are required in orthodontics, like tipping, bodily movement, and torque. Tipping means only movement of the crown. This is an example of uncontrolled tipping because when I'm applying force from here, my crown is moving lingually and my root is moving labially. The next figure is a figure of controlled tipping. That is when I'm applying force over here, my root remains over here and my crown moves lingually or palatally. Next figure is of translation, which is also known as bodily movement. Bodily movement is also known as translation, wherein what you see when my force is applied, my crown and root move simultaneously. Okay? And the next figure is of torque, that is root movement. That is when the force is applied, my crown remains in this position, but my root moves palatally. So to bring about different kind of tooth movement, my moment to force ratio varies. If my moment to force ratio is between 1 to 7, it will bring about tipping of the incisor or the tooth tends to tip. Okay. Now, if I want bodily kind of tooth movement, that is, I want the entire tooth to move labially, entire tooth to move palatally, I need to apply the force in such a manner that my moment to force ratio reaches 8 is to 10. So that will bring about translation. That is bodily movement. My entire tooth will move. Now, in the third situation, if my moment to force ratio is greater than 10 millimeters, it will bring about root movement. Root movement is also known as torquing. Okay, so yes, moment to force ratio. This comes under the concept of biomechanics in orthodontics. So let me tell you, students, if you are well versed with biomechanics, excellent. You will definitely be able to attempt this particular question. But in case you are not very thorough with biomechanics, and if you want me to cover this topic for you people, kindly write it down in the comment section below. Okay, so that I cover it up in the priority, because yes, I do not have it scheduled for a very long time as of now because I have other lectures scheduled. Okay, so this topic can be taken up in priority, but for that you need to tell me. So this concept comes in biomechanics where there is a cutoff to bring about different kind of tooth movement, different kind of forces and moment to force ratio is applicable. Okay, moving on to the next question. Sunday bite is defined as. Okay, again, a new question for you and an important one as well. Sunday bite is habitual forward posturing of mandible to class 1. See, in patients with class 2, my mandible is retrognathic. Okay, so when the mandible is retrognathic, the even patients know that their profile is not very good. So when they bring the mandible ahead this way, can you see? Habitually, I'm getting it ahead to into what? Into class 1. So this is known as my Sunday bite. Sunday bite is habitual forward posturing of mandible so that it comes to class 1 from class 2. Okay. What is the next option? Posturing of mandible to class 3 due to premature contact. This is your concept of pseudo class 3, where you will feel that the patient is having a class 3 malocclusion, but actually the patient is having a normal class 1 malocclusion. But because there is a premature contact, the patient is bringing the mandible ahead from class 1 to class 3. Okay, next. Posturing the mandible laterally to establish maximum cuspation. Okay, if there is a crossbite. Okay, and if the patient doesn't want to correct, and if the patient is not comfortable, he wants to correct the crossbite. So patient will on purpose move the mandible laterally because then that will result in cuspation, intercuspation. Okay, so this is a case of crossbite. Posturing the mandible back to class 2 when actually it is class 1. Okay, this is also seen. Patient has a class 1 skeletal pattern. The patient on purpose takes the mandible behind and it gives us the appearance of class 2. Okay, but yes, the question over here is Sunday bite, and the correct answer is habitual forward posturing of mandible to class 1. I think this was also a new question for you. Yes, I know this stuff, this series is coming out to be on tougher side, but it's okay. You are getting to learn something new. Okay. So yes, students, I hope you have attempted these questions along with me, and please do not get disappointed if you do not score well. So I think the questions which all of you would have got correct is maybe moment to force ratio 1, Development of palate 2. Coffin spring definitely 3. And I think all other questions were pretty new for you. So yes, we had 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 10 set of questions. I'm sure all of you have got a 3. But yes, I know that is not enough, but it's okay because this was a new series for you people. And I totally understand all the questions were really tough. So yes, on a credit score, if you have got a 3, you are somewhere on the fair or maybe poor zone. But if you have got more than 5 in this particular series, let me tell you that you are good because all the questions were really tough. So more than 5 is good, and let me keep the cutoff as 8. If you have got an 8 on 10 or more, you are excellent. Okay, I would say even more than 5 is really good because all the questions were tough, new, and of PG level. So if your NEET MDS question paper is really, really, really tough, you should be expecting these kind of questions. Okay, so I will not be just giving you all easy set of questions. Okay, few test series are a mixed bag. Few test series are really tough, and this one was one heck of a tough test series. I totally understand, but do not get disappointed. Go back to the previous lectures, attempt those, go back to all the previous test series, understand the question and answers, and whatever doubt you have, write it down in the comment section below. Any topic you want to be covered first, do let me know. Subscribe to my channel, and yes, keep attempting. Do not give up. Good luck and all the very best.